Meantime, the ability to confirm cases of COVID-19 across the region is coming to a grinding halt. Erie County's public health lab has no more available test kits.
But the health commissioner says that doesn't mean the county is powerless to fight the spread of the virus. 7 Eyewitness News reporter Madison Carter shows us what people are doing who now cannot get a test.
20-year-old Benjamin Szymanski has been home since Monday when he started feeling sick at work. He called his doctor and they ran some tests.
They did the flu test, strep test. Those were both negative.
Tuesday, he made a call to urgent care after he started to cough and have a hard time breathing.
They didn't think that my symptoms were bad enough to be tested because I didn't have a fever.
Wednesday, he was the one that got the call.
I got a message from one of my friends who I had recently seen in Ohio, saying that he had tested positive.
It was the same day the county announced it doesn't have enough supplies to test new cases.
The lady I was on the phone with started to tell me that they will be doing more testing if they get more test kits. And the way she said if, maybe a little bit concerned, but I'm assuming that she meant when.
It's actually the state that controls where the supplies are distributed, and right now, more than half of the state's 4,100 cases are in New York City. But the county executive is airing his frustrations with Washington.
We are under the assumption and do know that the White House turned down the World Health Organization's offer to provide test kits to the United States so that we could become preparing. Why they did that, you'll have to ask that question to the president.
Health Commissioner Dr. Gail Burstein says even though we don't have the ability to test right now, we're still getting information from the state and national trends.
No matter what the numbers are, we know that we're still going up. The important thing is, knowing when we're at our peak and knowing when we're coming down, and that's information that we can use to guide our behavior.
Now, Benjamin says he's going to stay in isolation in his room until he is able to get a test. And just moments ago, Dr. Burstein's office sent us over those guidelines for what they're telling people who feel they might have symptoms but can't quite get a test. It's this list here. It comes from the CDC. I know you can't read this, but some of the highlights are just saying cover your coughs and sneezes, stay to yourself, literally in your room as much as possible, and monitor your symptoms. Again, the biggest thing here is calling before you go to seek medical intervention so those hospital systems can prepare if you think you need to go in. For now, reporting in the newsroom, Madison Carter, 7 Eyewitness News.
Madison, some great reminders.